Do you know the difference between Hodgkin's and non-Hodgkin's lymphoma? If you're scratching your head, don't worry, you're not alone. These are two types of lymphoma, a kind of cancer that starts in cells that are part of the body's immune system. They might sound similar, but they're distinct in several significant ways. Let's start with Hodgkin's lymphoma. Named after Dr. Thomas Hodgkin, who first identified it in the early 19th century, this type of lymphoma is less common. It accounts for about 10% of all lymphoma cases. The hallmark of Hodgkin's lymphoma is the presence of a specific type of abnormal cell called Reed-Sternberg cells. Under a microscope, these cells are large and often described as owl-eyed because of their unique appearance. Now let's pivot to non-Hodgkin's lymphoma. It's far more common, accounting for the remaining 90% of lymphoma cases. This group includes a wide array of lymphatic cancers which can vary greatly in their severity, from slow-growing to extremely aggressive types. The key difference? Non-Hodgkin's lymphoma doesn't feature those owl-eyed Reed-Sternberg cells. Now you may wonder, do these differences matter clinically? Indeed they do. The types of lymphoma often show different symptoms and are treated differently. Hodgkin's lymphoma often presents with a painless swelling in the lymph nodes in the neck, underarm, or groin. Other symptoms can include fatigue, fever, and weight loss. Treatment typically involves chemotherapy, radiation, or a combination of both. Non-Hodgkin's lymphoma, on the other hand, can occur in any lymph node or even in other tissues and organs. The symptoms can be quite diverse, ranging from swollen lymph nodes, abdominal pain or swelling, chest pain, coughing, or trouble breathing. Treatment options can include chemotherapy, immunotherapy, targeted therapy, radiation, or even stem cell transplant in some cases. To summarize, Hodgkin's and non-Hodgkin's lymphoma are both types of lymphatic cancer, but differ in their cell characteristics, prevalence, clinical manifestations, and treatment methods. Hodgkin's lymphoma is less common, characterized by the presence of Reed-Sternberg cells, and often localized to a specific set of lymph nodes. Non-Hodgkin's lymphoma is more common, does not include Reed-Sternberg cells, and can occur in any lymph node or other tissues and organs. So, the next time you hear about Hodgkin's and non-Hodgkin's lymphoma, you'll know they're not just two sides of the same coin, but distinct in their own right. Knowledge is power, and understanding these differences can help us all be more informed about our health. Remember, early detection is key in combating any form of cancer, so don't hesitate to consult with a healthcare professional if you have any concerns or symptoms. Health, after all, is wealth.